Hi, and welcome to Girl Talk. Ooh, we're going to have fun today. The autumn is in the air, although it's still warm. And we're going to talk about some really interesting things. I am here. I have Dr. Jordan here, grounded, right? He is with ROC Dental Group. Thank you so much for joining us. It's been fun. We've been talking about all kinds of different things today. And I know we want to get a little bit about your background. So tell us, I know you're from Owensboro, Kentucky.
Yep, so I was born and raised in Owensboro, Kentucky, which is a small town in the western half of the state. And then for the last 8 years, I've lived in Louisville, Kentucky. That's where I obtained my bachelor's degree in cellular molecular biology.
Cool.
And then I attended the University of Louisville School of Dentistry.
So people actually major in cellular molecular biology. Interestingly enough, I talked to someone yesterday who was had a master's in genetics, and I was like, is that even possible? Wow. But you kind of have an interesting history. You wanted to be a dentist, and you took a pretty direct linear course.
Yep, so when I was a senior in high school, I did an internship at my pediatric dentist office. So that's what initially sparked my interest in dentistry. And then once I moved to Louisville, I continued to shadow dentists in the area. And that's when it solidified that I wanted to go to dental school.
And I think last time you were here, you said you had friends here.
Yep.
And you were a beach guy, and that's exactly what you wanted to do.
Yeah, so I always knew I wanted to live somewhere coastal, and I had friends that live in Hilton Head and in Bluffton, and it kind of just made sense to make my roots here.
I love it. Yeah. All right, Dr. Jordan, here's my question for you. Now we're going to talk teeth.
Okay,
ready?
Let's do it.
Okay. I would like to know what a good protocol for healthy tooth maintenance or teeth maintenance is. And if we could do even, children, adolescents, adults, and then older adults.
Yep.
Okay.
For sure. So when it comes with children, they really need to establish a dental home as soon as they have their first tooth erupt. So
I love that, a dental home. Yep. That's cool.
So that's typically around 6 months.
Okay.
So as soon as that first tooth is in, that's when you need to start brushing twice a day, because just like permanent teeth, baby teeth can get cavities as well.
Okay.
So typically with children, it's every 6 months. We recommend coming in for cleaning and a checkup. Moving on to adults, typically.
Or even adolescents. Let's talk about them.
So with adolescents, we are typically the same thing every 6 months.
Okay.
But that's when you're starting to get your wisdom teeth. That's when we start making recommendations for braces, and we're making referrals out to orthodontists. So that's a really pivotal time to be under the care of a dentist.
Okay.
Just to get a head start of things that could happen later on.
Is adolescents or young, kind of middle 10 to 15, is that when I should start with flossing and water picking and things like that? Or do I set that even a little bit ahead of time?
So just like I mentioned, baby teeth can get cavities just as well as permanent teeth. So as soon as you're starting to get teeth that are touching, that's when you start with the flossing and the brushing and twice a day.
Well, I laugh because Clementine, my little 3-year-old, I have 10 grandkids, and she loves to come over. Her favorite thing to do is brush her teeth, so we have a little area for her, and then water pick. And it is like she is in a swimming pool. But I mean, she's getting
water gets everywhere.
Yeah, she's getting the hang of it. And then let's skip, because we know adults, but in later life, and I'm 67, is there a protocol that's a bit different?
No, generally it's still 6 months for cleanings, but if we have, if there's ever a need to increase to every 3 months or every 4 months, that's normal as well.
As part of a normal exam, do you look for things that would be irregular, like skin cancers and things like that in the tongue and mouth?
Yep, we do. Okay. At every cleaning, we do oral cancer screening, but we're also looking around the lips, sunspots on the face, but
It's really interesting because I think it's really a comprehensive kind of practice.
Yep,
and you're really articulate. You're easy to talk to. We love it when you come. We really do. So will you join us again?
Yes, for sure.
That sounds great, Jordan. Thank you so much. Stay with us. There's a lot more to come on Girl Talk.